Cue. We are recording. It's wonderful to see you. Many of you have your camera on this morning. I tell you why we've been waiting for everyone to join. It's been lovely to read the chat and see who's here. Those of us who have are hosting this event have a list of the registrants, but you all don't know who all signed up. So if you're so inclined, it's just wonderful to have you enter your name in the chat, where you're from. As this title slide says, we're going to talk about the Kansas and Missouri legislative sessions. We will talk about 2022, not 2021, as the slide says, but we've got people here from all over both states. So it's just wonderful to have you with us and have you enter that information into the chat. So I'm Kathy Greenlee. I am, as it says, President and CEO of Greenlee Global. I have my own consulting firm. I live in Kansas City. But pertinent to our conversation today, I previously served as the Kansas Secretary for Aging and the U.S. Assistant Secretary for Aging in Washington. And I'm going to draw upon some of that experience as we go through today. I will be your facilitator as we move from topic to topic. We don't have a printed agenda. I thought I would tell you what to expect as we move through our discussion with you. We will first begin and talk about advocacy. We will then have a discussion about the budgets for both Kansas and Missouri and what happened in the most recent legislative session, in particular, the budgets that impact older adults. We will then hear from our colleagues with AARP in Missouri and Kansas, and then hear from the executive directors of the associations in each state that represent the area agencies on aging. And then we will do some wrap up and hopefully leave some time for questions. Because we've got so many speakers, we decided to leave questions for the end. If you have a burning question, put it in the chat and we'll make sure and stop and get that addressed as we move on. We've got people who are taking a look at the chat. So thank you for being with us. Yeah, I wish I could just peek and read all your names, but I shall not. We're going to start and talk about advocacy and your role as advocates in the work that you do. And I just want to give you a couple of examples from me and the work that I've done personally. You know, I have served and worked in both Topeka and Washington, D.C., advocating specifically for funding for services for older adults, and in my case, for people with disabilities as well. And I promise you that that job, advocating for older people, particularly advocating for money for older people, that job is much more effective if you've done your work as well. I have gone to the State House, gone to the US Capitol and advocated, for example, for increased money for senior nutrition programs. If I do that, if I go into Topeka or when I went to Washington, if I say to one of our lawmakers, you know, older people in Kansas and Missouri are hungry, if they have not heard that from you, they will not believe me. That the officials who have these roles in government to try to assist have to be the backup plan. You are the front line, and your work as advocates is essential in moving forward the work of your organization and the people that you're trying to serve. And so I'm not going to read every slide. I just have a few, but you as nonprofit organizations are allowed to advocate. And I know there are a lot of people who are very hesitant to do that because they're very concerned about lobbying. So I'm going to flip through in quick succession some slides to talk about the difference. But advocacy and talking on behalf of the people that you're serving and their needs is an essential part of a nonprofit's mission. And the leaders are better informed if you do your work. And advocacy is not the same thing as tracking a specific piece of legislation, although you can do that. Advocacy is really talking about need, talking as experts in the field about what you see and what the struggles are. Maybe in particular what the struggles are, because it's very hard for people to articulate themselves what they're struggling with as they move through their lives. But your job is to do that for them. And then someone like me could come in and say, we're hungry in Southwest Kansas or Southwest Missouri, and our state legislators or members of Congress will go, oh, you know, I heard that last summer. I mean, you need them to say, oh no, I've heard this. And then the conversation will be more effective. Let's do my next slide. Carmela. There are many resources for you who work in nonprofits with regard to how to learn to be effective advocates, how to improve your skills, and the sort of the movement or the impetus behind this work is really supported at the national level and here locally. There are, just me looking quickly online, could easily find information for nonprofits, Board Source, Stand for Your Mission, the National Council of Nonprofits. All of these national organizations have put together information for you so that you can be reassured that, like I like the center bullet, that public policy impacts the work of nonprofits and advocacy is the way for you to stand up for your mission. Of these different resources I've pulled, we do have their website address, their URL. So Kathy Boyer-Cecil is helping me out and dropping those in the chat because I've got a couple more slides with resources. I want you to be able to find organizations. And it's important that whatever your position is with a nonprofit, if you're the head of the agency, if you're on the board, if you're staff, that you know that there are resources to back you up and that this is really imperative. We need the voice of nonprofits in all sectors across this country. Carmelia, the next slide, please. So those are the national resources. And then when there's regional support, the Missouri Foundation for Health, whose headquarters is in St. Louis, has a specific program for health advocacy. If you want to learn more about how to be effective, about leadership, about collaboration, they have specific information and curriculum, and I believe a program that you can sign up for or hope to be selected for to learn how to be better effective advocates in Missouri. And that's really essential that you know that the nonprofit sector, who's often relying upon foundations and philanthropy, that these are essential partnerships between the sectors, and your funders, your nonprofit funders from philanthropy really encourage you to be involved in advocacy. Here in Kansas City, Nonprofit Connect does something similar across state lines in the Kansas City region, help build capacity for nonprofit advocacy. And then on the Kansas side, the Sunflower Foundation does this as well, helps nonprofits be more effective. Like the Missouri Foundation for Health, the Sunflower Foundation focuses on health, and they have had cohorts of health policy interns for like a decade or more, where they bring people to Topeka. And when I was serving as Assistant Secretary in Washington, they came to Washington. So I had a chance to meet with them in my offices in DC as well to talk about the important role of advocates. Next slide, Carmelia. So what is lobbying? Because when we talk to stakeholders or nonprofits, we know that some of the concern out there is, I don't want to get in trouble. I don't want to be a lobbyist. Both you don't want to be a lobbyist and you don't want to accidentally trip into lobbying. Well, there are specific rules for lobbying, and the governing bodies for both states are found in the ethics commissions, the Missouri Ethics Commission, the Kansas Ethics Commission. They have guidance online as when you need to register to be a lobbyist. And basically, it's if that's what you're doing in the ordinary course of business, is your job is to follow the legislature, and that's what you do. If you've been designated to be a lobbyist, then you may need to lobby to register as a lobbyist. But it's very specific on the website for the Missouri Ethics Commission that if you're testifying as a witness before the General Assembly, then you're not engaged in lobbying. Same as if you appear before a board or commission. The Kansas Ethics Commission, if we can move to that slide, is very similar. There are, very specific rules that if you're doing this to a considerable degree, then you should lobby. You should register as a lobbyist. But advocacy and lobbying are not the same thing at all. Finally, I have a slide about the IRS, and we'll put a URL note in the chat as well. This is where the base fear comes from. There's a concern that if you're lobbying, you should register, but no one wants to lose their nonprofit status. And it's very clear if you look at the IRS information that organizations can involve themselves in issues of public policy without actively be considered as lobbying. And they have a whole list of educational activities that they really encourage nonprofits to be engaged in. And that if you're engaged in substantial amount of legislation, attempt to influence legislation. Only if it's substantial do you get to the point where you may be engaged in lobbying. But it means something very specific, and that's the final bullet. Contacting decision makers about a specific piece of legislation and asking for a vote. Likely what we need you to do, and some of the examples we have for you today, do not fall in this category of at all risking your status as 501c3s. So we're going to meet someone new now. We're going to talk to Nicole Lynch, who's Policy and Advocacy Manager for VOYCE. And not new to me, but Nicole had an interesting legislative session, and she's going to talk to you about what we've been up to on the Missouri side in terms of increasing our advocacy for older people. So hi, Nicole. What did you do last session?
Hi, Kathy. Thank you so much. And hello, everyone. Like Kathy said, my name is Nicole Lynch, and I am the Policy and Advocacy Manager for VOYCE. That is a St. Louis-based nonprofit organization. And I am also the project coordinator for the Aging and Disability Advocacy Network, which is a new advocacy initiative in Missouri. So you all just heard Kathy talk about the importance of nonprofits getting engaged and getting involved with policy advocacy. So I am going to share with you all an example of how nonprofits and other groups can really impact policy when we come together and we work together for shared goals. I'm only going to be with you very briefly today, so I'm first going to quickly talk about the Advocacy Network, and then I'm going to share with you a quick example of how we were able to make an impact in the state. So the Aging and Disability Advocacy Network, or I frequently call it just the Advocacy Network for short, was established within the last year, and it was in support with funding from the Missouri Foundation for Health. The goal of the network was simply to create a shared space for stakeholders in the aging and disability space to come together and talk about activities that are going on in the state legislature. So we brought a variety of groups together, and we hosted bi-weekly Zoom calls to provide education on the bills and policies moving through the state legislature that would impact older adults, and when and how to engage on those policies with lawmakers at key times. And so in our meetings, we talked about many different policies, from the state budget to federal COVID relief funds, to nursing home reform, to voting rights, and so on. But something really quite amazing and unique happened through our work with the Advocacy Network. We had been following a bill that was brought to the Senate floor for the debate. The bill was called the Restaurant Meals Program, and it was intended to reduce food insecurity among low-income older adults by allowing them to use their SNAP benefits to purchase ready-made hot foods from certain participating restaurants at a reduced price. Now, I don't want to speak for others, but this bill was really a bill that I did not expect to see move through our state legislature, considering the Republican-controlled supermajority. Reducing food insecurity is simply just not one of their key priorities for the legislative session. So when the debate started for this, we heard nearly 3 hours of opposition from a very small group of Republican senators that did not like the bill. But while that was going on, members of the Advocacy Network were working behind the scenes. They were calling their state senators. They were emailing those who were in Jeff City and able to go to the Capitol. Were having in-person meetings with their state senators to really talk about the importance of the bill. So we saw people from the AAAs, the silver-haired legislators, anti-poverty advocates, disability advocates, self-advocates. Everyone really came together of those that were on our network calls and had been hearing about this bill and the importance of this bill, came together and started reaching out to their senators. And after 3 hours of debate and opposition, all of a sudden, we saw a senator from the Republican Party, a new senator from the Republican Party, stand up and publicly support the bill. And then all of a sudden, we saw another one stand up and another one stand up. And by the end of debate, we had 7 or 8 members of the Republican Party standing up to publicly support this bill, which ultimately ended up being passed out of the state Senate. And that was a direct result of the advocacy work from the people that were on the network, that were just simply reaching out to their local state legislators that represent their area to say, hey, this is really important to us and to the population that we serve. So to conclude, I'm just going to leave you today with a call to get involved and become an advocate in your state or your community, because your voice actually has a really important and big impact. And so you will see my contact information there on the screen. If you are in Missouri and you're interested in getting involved in our Aging and Disability Advocacy Network calls, I can add, if you reach out to me, I can add you to our listserv. We will be doing those, starting those back up again for the 2023 legislative session. And in Kansas, if you're interested about learning more about the network, or if you're interested in starting your own, also feel free to contact me. I'm happy to talk to anyone. But yes, thank you everyone, and back to you, Kathy.
Thank you, Nicole. Congratulations. Thank you. I know you had a session different from any other because of this work, but you have a fabulous example of how effective advocacy can be and what it can result in. And it's important as we talk about advocacy from nonprofits like you did, that it's about telling people what's happening at home. That each of those senators who started to stand up and speak on behalf of that legislation knew it back home. That advocacy can be just as important at the grocery store, or at the senior center, or at a church as it is in the Capitol. And that's where people legislators get their best information. They really do want to hear from constituents, and we should not be so cynical that we don't believe that, because they really do want to hear from their constituents at home. So thanks. We're going to talk about budget. Budget is always one of my favorite topics, I have to admit. And we have two budget experts to share information with us today. For the Kansas budget update, we're going to hear from Karuva Kaseke, who's a fiscal policy analyst with Kansas Action for Children. And she will be followed by Lindsay Baker, who's a research director for the Missouri Budget Project. So my budget friends, I'm turning it over to you.
Hello, good morning. Thank you so much for having us be able to speak on the budget. As Kathy said, I am Karuva Kaseke, and I'm the fiscal policy analyst at Kansas Action for Children. And Kansas Action for Children is a research and advocacy organization that advocates for fiscal responsibility so the state can afford to fund vital programs like education, healthcare assistance, and investments in childcare. And since the state budget underpins all of these efforts, this is why I've been invited, and I'm thrilled to be included in this legislative update. Next slide, please. So in Kansas, as we're looking back at the 2022 session, which just ended, and how the budget played out, there are three major themes from that session that I'm going to discuss today. And these are, first, the historic budget surplus that the state achieved, which led to numbers 2 and 3. Number 2 being opportunities to make long-term investments to strengthen the state. And number 3 was a big push to address the second highest food sales tax in the country. Next slide, please. So as lawmakers began working on the budget for the upcoming 2023 fiscal year, which starts in July, which is next week, I just realized, the projected surplus was higher than the state had ever seen. So it was projected to be $2.8 billion, which was primarily the result of two major out of the ordinary factors. So first was federal legislation such as the CARES and American Rescue Plan Acts, which were passed in response to the state's needs to fight the COVID-19 pandemic and to address the impact that it was having on businesses and schools and communities and families all across the country. So with these pieces of legislation came a wide array of programmatic and one-time funding, which enabled the state to use federal funds instead of state general funds, which could then be diverted for other uses or saved for future use. So an example of this was the temporary increase in the federal medical assistance percentage, which is the portion of Medicaid that the federal government covers, which allowed the state to continue and even enhance programs without needing to use more state general funds. And second, Kansas, like many other states, also experienced higher than projected tax revenues, due in part to higher income and sales tax collections from increased consumer activity as Kansans were spending their stimulus payments, or others moving to better paying jobs, and many were also receiving pandemic-related bonus and retention payments. So again, none of these factors nor the outcomes were unique to Kansas. Many other states also experienced historic surplus last year. Next slide, please. So in our legislature, the strategy for expending the revenue, or the kind of philosophy for it, was prioritizing strategic and targeted one-time investments, which would have a large impact on the state, but have as little recurring cost as possible. So this led to 3 valuable long-term investments. The first was making a large enough deposit into the state rainy day fund so that it could fulfill its purpose, which is to help preserve state operations and services in the event of a fiscal downturn that reduces revenue. So for several of the past few years, Kansas had been an outlier and was one of 4 states which had 0 money set aside for emergencies. So this was a big goal across across the political spectrum. And we're glad to see that achieved. And the second was leveraging some of these funds to make large payoffs for some of the state's debt obligations. So we have a new lab that is being built for the state health department, and paying this off now will save millions in future interest payments that will free up state general fund money for other uses. And third was catching up on deferred payments to the state employee retirement fund, and making payments toward the unfunded amount. So several years ago, when the state was going through some budget troubles, they deferred those payments. So a portion of this, about $253 million, will be to catch up on those late payments. And then about $870 million will go towards the unfunded amount, which brings us closer to the goal of fully funding that account. Next slide, please. So there were also some measures included to provide relief for Kansas in critical areas of need. And among those were, first, reducing the state level tax on groceries. Now, as I mentioned before, Kansas currently has the 2nd highest food sales tax in the nation. And of the several proposals presented, the bill passed would reduce the sales tax from 6.5% to 4% beginning on July 1st of 2023, and then down to 2% on January 1st of 2024, and eventually down to 0% and full elimination by January of 2025. And second was expanding eligibility for the child care tax credit for employers who are providing or subsidizing childcare costs for employees. So previously, this was only available to large corporations and financial institutions, and now will be accessible to all Kansas businesses. Next slide, please. And as I mentioned earlier, there was a significant amount of federal funding provided through the American Rescue Plan Act. And among the state's many investments using these funds were $1.5 million for senior nutrition programs, such as Meals on Wheels, $12.5 million for rural economic development to help build facilities and infrastructures to attract businesses to areas in rural Kansas, and also partly in support of that economic development push was a massive investment in rural housing development, so $23.1 million. And prior to this, the state had been appropriating only about $2 million a year to develop the state's housing stock. And a statewide housing assessment, which was released late last year, showed that there was a severe shortage of affordable middle-income housing, especially in rural areas. So not only will this impact individuals and families looking for homes, but also businesses who are hesitant to invest and expand in areas where there is no nearby workforce. Next slide. Thank you. So at the end of the session, the approved budget for the upcoming fiscal year, which starts next week, is $22.9 billion, with $9.1 billion of that being state general funds. And again, as I said, the state had a lot of money coming in because of the high surplus, but there were many needs given the ongoing public health emergency and the focus on recovery. So we at KSC were very happy to see the legislature addressing these long-term responsible pieces and the high food sales tax by putting in place that reduction. And we welcome the impact that they will have on the state's ability to keep functioning and providing services, and the relief, especially for low-income families, that will result from the lower food sales tax. And most of all, we hope that the added flexibility in the state's finances will enable them to make more bold and targeted policy decisions to further improve the lives of Kansans. Next slide. And so with that, I thank you all for your time, and I'm happy to answer your questions at the end or through the contact information included. During the session, KAC, we publish weekly newsletters to kind of update and keep track of the bills that we're monitoring. And we also have a monthly newsletter that goes on. So if you want to contact me to get put on that list, I'd be happy to do that. Thank you so much.
Lindsay, straight to you, I think. Thank you, Karuva.
Great, thank you, Kathy, and thank you everyone for being here. My name is Lindsay Baker, and I am the Research Director for the Missouri Budget Project. We're an organization that focuses, a nonprofit, nonpartisan organization that focuses specifically on analysis and advocacy related to budget, tax, economic, and health policy here in the state of Missouri. And we're also a sister organization to Kansas Action for Children. So much of what I'm going to be talking about today will sound familiar after listening to Karuva's presentation. Usually the states all vary a lot in the health of their budgets and the dynamics that are happening within those budgets. This year, you're seeing a lot of the same dynamics occurring across the country. And in particular, Kansas and Missouri are seeing some very similar dynamics given the federal stimulus bills that were passed and the level of federal funding that is flowing through state budgets right now. So much of what I'm going to talk about is going to sound familiar. If you could go to the next slide, please. So Missouri's state budget for fiscal year 2023 is significantly larger than it usually is. And that's, again, because of those federal COVID stimulus bills that were passed that are now flowing through that state budget. So in a usual year, our budget is around $30 billion annually, and about a third of that funding comes directly from the federal government. In the fiscal year 2023 budget, we're looking at a closer to $50 billion budget, and about half of that funding is coming directly from the federal government. So we're looking at a very significant increase in the total budget, and also an increase in the share paid for through federal funds. Next slide. And again, as I mentioned, that's really due in large part to these federal funds that are coming into the state for multiple stimulus bills. But I'm going to talk a little bit now specifically about the American Rescue Plan, which was largely appropriated, but not entirely within the fiscal year 2023 budget. This was the last fiscal COVID stimulus response bill. And it had dozens and dozens of pots of money that are flowing to particular pieces of the budget. This slide is not an exhaustive list of all those funds that are flowing through the budget, but shows kind of those main pots of money that are flowing into the budget from federal funds. And I want to kind of highlight a couple of these here. So first, Missouri received a significant amount of money to expand Medicaid. There was an incentive provided to states to expand Medicaid for those states who had not already expanded Medicaid. And Missouri hit the timing just right on this. We had already passed Medicaid expansion, but we had not yet implemented it. So Missouri was able to take advantage of this, and they received an additional over $1 billion in order to expand Medicaid to support that program. We also have a significant amount of funding that's flowing through that's related to the enhanced FMAP that Karuva has already mentioned. So this is meant to support the additional requirements that are put on Medicaid during the public health emergency. And this is really to, in particular, to support that continuous eligibility requirement, which means that during the public health emergency, during COVID, the state is not allowed to drop people from the Medicaid program. People have to stay enrolled in the program and have access to health insurance. And so over a 3-year period of the public health emergency, I think the slide says 20 and 21, but it's actually FY 20, 21, and 22. Missouri is going to receive about $3 billion in additional federal Medicaid funding because of that enhanced FMAP. Finally, there's also a pot of money called the State Fiscal Relief Fund. And this is a more flexible pot of money. So most of the federal dollars that were flowing in were earmarked for very specific purposes, with very specific rules. And this is a flexible pot of money that's meant to let states be able to fill whatever gaps they need to address and whatever types of programs they really need to focus on in the state. Missouri received $2.7 billion in that state flexible fiscal relief. And if you could go to the next slide. So this is how Missouri has appropriated those American Rescue Plan state fiscal relief dollars. There were some rules about how these could be spent. They were very flexible. There were specific rules on how they could be spent. Paying for water infrastructure was one of these, paying for broadband. Those were specific things that were called out. And you can see Missouri is using some of those funds to pay for those things. I want to be clear, this is separate from the federal infrastructure bill that was passed. So these are separate dollars that will be on top of whatever funding is provided within the federal infrastructure bill. A little over $1 billion of those flexible funds will go directly toward addressing the health and economic impact of COVID. And then finally, a significant amount of money is going toward what's called revenue replacement. And what this really means is that funds that are usually paid for with general revenue dollars are now being paid for with federal revenue dollars to basically fill those gaps that are in the budget. And that frees up general revenue to be spent on other purposes, both this year and in the coming years. So overall, we've got a really healthy budget right now. It's a very, I'm not used to coming to these presentations. I see a lot of familiar faces, and you're usually used to hearing me give you some bad news. It's really a lot of good news this year, but I do want to flag for everyone. These are temporary dollars that are flowing through the budget. They are really great one-time investments that are being made that will have budgetary impacts for many years to come. So even though a lot of these are one-time investments, they will set the state up to have a better budget in the future. But on top of that, we do know that these funds will run out. We need to continue to advocate both at the state level and the federal level to make sure that we're able to continue to make these investments in future years. And that we're able to support those programs that have received increases or have been expanded through these federal stimulus programs or through those general revenue dollars that have been freed up. And next slide, please. Just a few quick budget highlights. So Medicaid expansion was fully funded in this budget. Home and community-based services received significant funding and expansion. Also increases for the area agencies on aging, funding for the suicide hotline, and funding for redeterminations of Medicaid once the public health emergency does end. And next slide, please. So the final thing I want to mention before closing out. In the final days of session, there was a tax bill that was rushed through. And this tax bill would leave out nearly a third of Missouri taxpayers. And in particular of interest to this group, it leaves out, in particular, people who rely on Social Security, so older adults, Missourians with living with disability, who rely on Social Security for their income. The way that it was structured, it's focused primarily on the amount of income taxes that you pay, but we know that a lot of Missourians, low-income Missourians, older Missourians, even though they pay a small amount in income taxes, they do pay taxes. They pay sales taxes and they pay property taxes. And when you structure a tax rebate or recovery rebate in this way, it leaves out those very Missourians who need that investment most. So we are encouraging the governor to veto this, and we are encouraging partners to really get the word out about this tax rebate. A lot of people are left out. And the other thing about this is because there is a cap on the amount of money the state can spend on this rebate, we know that the size of the tax rebate is not as large as what is being advertised. People are being told it's a $500 rebate or $1,000 for joint filers. But in reality, the average person, say, making $52,000 a year is really going to only get $169 annually. So, we want to encourage the veto on this, and we also want to encourage people to educate people about the real impact of this tax payment. And next slide. So if people are interested in learning more, you can go to www.mobudget.org. You can sign up for our weekly e-newsletter. Email me at lbaker@mobudget.org if you have questions or if you want to join our weekly legislative calls and budget updates. And you can also follow us on social media. So happy to answer questions by email or also at the end. So now I'll turn it back over to Kathy. Thank you.
Thank you, Lindsay. Lindsay, there's a question in the chat from Rachel you might be able to respond to. I'll point you to that while we keep keep moving. So we're now going to turn to our colleagues from AARP, Ernie Kutzley with AARP Kansas, and Jay Hardenbrook, who AARP Missouri. Both of them serve in the role as advocacy director in Kansas and Missouri. Both have incredible skill and a lot of history and experience working with legislators, and they still do it. So I'm so proud of them. They're going to go back and forth. Their presentation is a bit of a joint presentation to give you some comparisons. So let me turn it over to Jay and Ernie. Thanks for being with us, you guys.
Yeah, thanks so much, Kathy. And thank you, everyone. This is such a great group for us to be able to be a part of. And much like the two budget organizations, AARP, both in Missouri and Kansas, follows very similar issues. So it just makes sense for us to kind of go back and forth on the issues and how they were wrapped up in Kansas and Missouri. I will say the big issue for both sides was the budget, as we just heard. But we'll run through some of those other issues as well as we go along. Next slide, please. So we'll start with the Medicaid expansion issue, which was definitely a big topic over on the Missouri side and has been for many years. As Lindsay pointed out, Medicaid expansion was fully funded in the state budget this year for the first time. And another resolution, House Joint Resolution 117, which would have allowed the General Assembly to defund Medicaid expansion and would have instituted these work reporting requirements, which would have made it nearly impossible for unpaid family caregivers to enroll in Medicaid expansion, was defeated. I have to give lots of thanks to all of the health advocates who worked on this issue, contacted their legislators, worked on making sure that there were filibuster packets created. But really, at the end of the day, what happened was a Senator Lincoln Hough, who is the vice chair of the Appropriations Committee, but more importantly, the chairman of the Government Accountability and Fiscal Oversight Committee, was able to stop that bill from passing by just refusing to have a hearing in his committee. So a lot of respect and props go to Senator Lincoln Hough for that. Ernie, I'll turn it over to you for the Kansas side.
Thank you, Jay. Appreciate that greatly. Greetings, everyone, and thank you for being here this morning. So unfortunately, on the Kansas side, no expansion bill was given serious consideration. There were a couple of bills, House Bill 2459, that was introduced as a single payer guaranteed health care coverage bill, and Senate Bill 472 that would have constituted express consent from the legislature to expand eligibility, but neither had a hearing during the session and both died. So there were several attempts to amend CanCare expansion onto bills brought to the House and Senate floors, but they didn't make it very far. So no good news for Medicaid expansion from the Kansas side. So moving on to home and community-based services. Next slide, please. So I wanted to talk briefly about a couple bills that were very important. Senate sub for House Bill 2279, the APRN scope of practice bill. We fought really hard for this over the last several years. Governor Kelly signed the bill, and the bill establishes that advanced practice nurses in Kansas can practice independently to the full extent of their education, training, and skills. Kansas became the 26th state to grant full practice authority to APRNs. And the law includes elimination of the collaborative agreements previously required between APRNs and physicians, stronger definition of prescriptive authority, licensure and malpractice insurance requirements. And the bill will expand access to high quality, cost-effective primary care for all Kansans, especially those in underserved areas. The other bill that I wanted to talk about was House Bill 2114, was passed in 2021 that created this Kansas Senior Care Task Force. And that task force in the bill, it outlines the studies that the task force will look at. And we also added a subgroup or a workforce subgroup for looking at staffing and workers in Kansas. We have two working groups, quality of care and protective services and access to services, and then the workforce subgroup. So we're trying to finalize recommendations for the 2023 legislature at this time. And I think we have 2 more meetings of the full task force this session, or this summer. So back to you, Jay.
Yeah, so on the Missouri side, and Lindsay did touch on this just briefly, a lot of the American Rescue Plan funds, about half of those funds went to modernizing the infrastructure for home and community-based services and consumer-directed services, and the other half went to increasing provider rates. So obviously that increased funding in infrastructure will be a very positive thing for the entire system, but also on those increased provider rates, which really are going to allow providers to pay a competitive wage for home care workers. We are going to have to continue to work in the future since these are one-time dollars. Well, they are one-time dollars, but at least in the budget, it says they will be ongoing funding to make sure that that ongoing funding continues. So that is something we will continue to work on into the future. Next slide, please. On the voting restriction side, this became a very big issue over in Missouri. There were dozens of bills that were filed to try to restrict voting. I think for anyone who follows this, that's not a huge surprise. House Bill 1878 was the final bill that actually made it across the finish line, and we do expect the governor to sign that bill in the near future. We also expect there to be court action upon the signature, and the effective date for this bill will be the end of August. So that's after the state primary, which is at the beginning of August. I will say included in this bill, there are a lot of very dangerous things, especially for the aging and disability community. But the thing that is probably getting the most attention is that it would require that you have a DMV issued photo ID or a passport in order to vote in person. That, of course, is very, very difficult for people who have allowed their IDs to lapse. And especially if you vote on election day, you most likely don't have enough time to get that ID in time to show up and vote. Again, there's a lot of other issues inside that bill. If you're interested in getting more connected with that, I suggest that you reach out to the Voter Protection Coalition here in the state of Missouri. Ernie, back to you.
Thanks, Jace. So on the Kansas side, House Bill 2138 was an election reform bill that was signed by the governor. The bill contains important election security enhancements for the state of Kansas, including equipment security, additional audits to increase transparency, voter roll maintenance to ensure accuracy, ballot watermarks to provide an additional layer of verification, and chain of custody to provide detailed information of each ballot and its security. And as I said, that was signed into law by the governor. We looked at House Bill 2252 also, which was vetoed by the governor, but her veto was overridden by the legislature. And that bill will prohibit the modification of election laws by agreement, except as approved by the Kansas Legislative Coordinating Council. Next slide, please. So I wanted to talk briefly about consumer issues. So we all remember last February when it turned so terribly cold for so long, and people were really, really hard up for gas and electric usage, and the power grids were not good as far as providing all that. But the Kansas Corporation Commission during that time issued an emergency order directing utilities to ensure that natural gas and electric service continued to their customers. The commission has now opened several dockets allowing utilities to file for recovery costs from those extraordinary event costs. So some of those utility plans have been approved and some are still in the process of being approved. But most likely in all those plans, there will be a cost increase for a number of months to Kansas consumers who use electric and gas. So I would encourage you, if you're curious about that, to look at the Citizens Utility Ratepayer Board website or the Kansas Corporation Commission's website to learn more about that. And as we look at the weather that we've had the last couple of days or the last week or so with the heat, that will only be added on to consumers' utility bills as we go forward. So the other thing that we looked at was House Concurrent Resolution 5023 that went through the House and Senate. And that resolution was passed that condemned price gouging during the winter storm and supported investigations into extraordinary price increases of wholesale gas during the extreme cold weather in February. Jay, your turn, sir.
And I wanted to specifically highlight an issue, plant in-service accounting, which was actually passed 3 years ago. But this year there was legislation to extend the sunset on that plant and service accounting financing scheme. It's already led to an 8.5% increase for those of us who are Ameren customers in the state of Missouri, and we expect it to be a double-digit increase for Evergy over the next few years. So we were able to get some moderate positive changes to these bills. One was that instead of a 15-year sunset, we got it down to a 5-year sunset increase for the plant and service accounting. And we also put in a requirement that both the Public Service Commission and the Office of Public Counsel review plant and service accounting and what the value has actually been for consumers in the state of Missouri. And that will happen in 2 years or when the original sunset would have happened. But it's definitely something for us to keep our eyes on as we move forward into the future. The other issue, construction work in progress, which just seems to come back up over and over again. It specifically was used in the past to try to build a second nuclear plant in the state of Missouri, in the Ameren service area. It has led to massive cost overruns in other states where it has been passed, and at least in 2 different states. It has led to massive cost overruns on a plant that has never gone into effect. So it's not in service. People aren't getting that power, but they are paying the cost to the tune of billions of dollars. So we will continue to work on preventing that type of legislation from moving through in the state of Missouri. Next slide, please. And then nursing home reform became a really big issue this year. I know many people on this call heard from family caregivers and consumers of the nursing home industry throughout the COVID-19 pandemic, that people just weren't able to contact their loved ones or able to get in and do the basic services that they were doing. So we were able to pass legislation, actually several pieces of legislation that included the language to allow for visitation rights for families, whether that's in person or digital visitation, so that they can check in on their loved ones, but also caregiver access for loved ones inside of nursing homes so that they can come in and care for their loved ones. Ernie, I'll turn it back over to you.
Thanks, Jay. Appreciate that greatly. So we looked at several nursing home bills on the Kansas side. Senate Bill 453 was approved by the governor. It requires adult care home certified aides who take training courses to demonstrate certain skills to successfully complete such training courses, and requires licensed nurses to teach and evaluate such training courses. It also prohibits certified nursing assistants not completing the course within a specific period of time from providing direct care to individual residents. We also looked at Senate Bill 286, which was vetoed by the governor. The veto sustained. The bill extended healthcare providers immunity from civil liability in terms of COVID-19 pandemic until 2023. The shield, addressing damages, fines, and penalties for the healthcare decisions related to the pandemic, would have broadened to include people not employed by a medical facility or providing direct healthcare services. So we also looked at House Bill 2004, which was called Charlie's Bill. House Bill 2004 would add law to the Adult Care Home Licensure Act, allowing a resident of an adult residential care facility to appeal a pending involuntary transfer of discharge to Secretary of Aging and Disability Services. And that died on the calendar to everyone's dismay. However, the Judicial Council's recently created advisory committee on adult care home involuntary discharge appeals is focused now on House Bill 2004, which is Charlie's bill. And looking at the calendar, they have 4 meetings coming up this summer and early fall. So I would encourage everyone, if you haven't looked at Charlie's bill, to look at House Bill 2004 and reach out to those in the Kansas legislature to support House Bill 2004, Charlie's bill. So Jay, back to you, sir.
And then prescription drug assistance in the state of Missouri has been a big issue for the last 5 years. When MoRx was cut and over 60,000 people were cut off of that program. This year, we actually had to focus on extending the sunset for that program for the remaining 120,000 people who are still on the program. That sunset extension, again, was able to get really added on to the nursing home reform bills. So it was passed in 3 different places, and we do expect the governor to sign that sunset extension. I will stress that this does not restore eligibility to those over 60,000 people. It just extends the program as it currently stands. We will continue to work on restoring that eligibility in the coming years. Ernie?
Thanks, Jay. On the Kansas side, we looked at House Bill 2721, which was kind of a tax bill, but it removed the sales tax exemption, or provided a sales tax exemption for over-the-counter drugs, which would be defined as a drug containing a drug label or facts about drug ingredients. But unfortunately, like many other bills, that bill died on committee or in committee with no hearing. So next slide, please. So I wanted to talk briefly about the bill that we supported across the years, was around for I'm not sure how many years, Senate sub for House Bill 2239, the Golden Years tax bill. So the bill amends law relating to property tax, income tax, and sales tax. The bill provides for homestead property tax refund claims to be paid to claimants for the amount by which the claimant's residential property tax exceeds the amount of the claimant's property tax for the base year. So if you have a base year, let's say 2022, and your property tax is X, then that would be it for a number of years. It also included an additional personal exemption allowance for veterans who have been honorably discharged and have 100% disability through military service to receive an additional exemption amount of $2,250 from individual income tax beginning in the year 2023. And I think the last one on there, Karuva talked about earlier, was the food sales tax that we lobbied very hard to get passed both in the House and the Senate. That reduces the 6.5% food sales tax now to 0 in January 1st of 2025. And Glenda, I didn't know if you were in the queue and wanted to speak on the food sales tax, or.
Just that we were very pleased to be able to support that. Even though it was not the total elimination that we had asked for, we were pleased to see the reduction in process.
Thank you. Jay, back to you, sir.
And I will reiterate something that Lindsay from the Missouri Budget Project specifically brought up, which was the individual tax credit or tax rebate. We were very happy to oppose that legislation during this legislative session. But specifically, I want to point out that the vast majority of people over age 65, especially if you're living off retirement income, are not eligible for any of that tax credit. But also that we've gotten a lot of calls and emails from people saying I could really use that $500. First of all, nobody's going to get $500 from that tax credit, even though it says it in the bill. It is capped at $500 million. But then also that the vast majority of people are going to get significantly less than that. And it could wind up being very similar to the 1990s when people got their Hancock refund that was less of a check than what the stamp to send it was. So it's very bad policy, poorly written, and we do expect and hope that the governor will be vetoing it in the coming days. Next slide. This is the contact information for both Ernie and myself. That is my cell phone number, which is the best way to reach me, but also my email as well. Do feel free to reach out, especially as we get close to veto session and the next legislative session. I'm always happy to include people on what's happening in the Capitol at any given time. So thank you all so much for your time, and we'll be happy to answer questions later in the call.
Thank you so much.
Thank you, Ernie and Jay, for your work during the session, for going through this morning. I do want to point out people should keep an eye on the chat. Ernie and Jay just had a slide with their contact information. We will make these slides available, but we're also putting contact information in the chat, so you can pull it from there if you didn't have a chance to grab that. All right, next two people to talk to us, Leslie Anderson, who's the director of the Kansas Association of Area Agencies on Aging and Disabilities, followed by Julie Peets, the executive director of the Missouri Association of Area Agencies on Aging. So good morning, Leslie and Julie. Leslie, I think you're going first, or at least it looks like your slides are going first. So.
Thank you, Kathy. Good morning, everyone. I'll talk briefly.
Leslie,
Yes,
will you move closer to your speaker?
yes. How was that?
Okay, we want to hear you.
Okay, thank you. Good morning, everyone. I'll talk briefly about the public policy priorities for the Kansas area agencies on aging and legislation related to our priorities. In addition to focusing on sales tax exempt status for the 8 non-government AAAs, our priorities included the Senior Care Act. Created in 1989, the program is a community-based, smart dollar, cost-effective model of coordinated care to divert older adults age 60 and older from premature nursing home stays and from costlier services. The act requires area agencies on aging to administer the program and enter into contracts with local providers to deliver services. The state general revenue funded program provides in-home, homemaker and respite services, personal emergency response systems, nutritional supplements, case management, and other services based on needs identified through a formal assessment. COVID impacted the program substantially by reducing the number of customers served from 3,996 to 1,874, although there was a cost avoidance of $7.1 million. After intense efforts by K4AD and the Kansas silver-haired legislature during the 21 session, the base funding was increased by $3 million. As the Senior Care Act is an income-based, cost-effective program, it has gained a significant amount of attention. Next slide, please. House Bill 2114 created the Senior Care Task Force to review programs specific to aging, including the implementation and funding of the Senior Care Act. The bill was amended to include the development and funding of multidisciplinary teams and a program coordinator to address elder and dependent adult abuse, originally in House Bill 2151. The AAAs are a member of the team as needed, and currently the Attorney General's office is searching for a program coordinator. House Bill 2543 proposed to expand eligibility of the Senior Care Act to include persons diagnosed with younger onset Alzheimer's disease. The Alzheimer's Association identified meals as one of the needs for the added population. The bill died in committee because the fiscal note was about $10.5 million. I also included House Bill 2543 because nutrition services funding has not increased since 2009. And in response to increased costs of food, labor, and fuel, we believe that it was time for the legislature to take note. So it was a move in the right direction with the one-time $1.5 million of ARPA funds being allocated to nutrition. Next slide. That's all I have for you today, and I'm happy to answer your questions at the end or by contacting me. Thank you so much. Kathy?
Thanks, Leslie. Julie, you're up.
Good morning. Good
Hello?
morning. And yeah, oh, can you hear me?
Yes.
Okay, sorry. Good morning, and thanks again for joining us today. If you're enjoying today's discussion, tune in for more and join us at the Show Me Summit on Aging and Health this September 12th to 14th in Kansas City. After a 2-year pause, we are delighted to return to an in-person summit this fall. And this year is especially exciting as we're partnering with the Kansas City area group Age Positive. Our theme this year is We Are Better Together, and today's focus on advocacy will continue at the summit with a special keynote from Kathy Greenlee, who of course is our esteemed host today. The summit will include some sessions on intro-level advocacy and intermediary level advocacy, and we will introduce 2 new advocacy and research tools. The first is an all-new budget report and tracker in a dashboard format, which was developed by the Missouri Budget Project. The new dashboard includes comprehensive info on Missouri's current and historical spending on services for adults who are aging and adults with disabilities. And secondly, from the University of Missouri, a brand new Missouri Senior Report will be debuted at the summit, also in a dashboard format with updated and richly enhanced demographics, data points, and indicators about Missouri's adults ages 65 and plus. To find out more and to register for the Show Me Summit, go to the MA4 website, which I'll drop into the chat as well. And I think that'll be in a follow-up email also. Thank you for your time today. And Kathy, back to you.
Thank you, Julie. Hope to see everybody at the summit. It's nice to be able to do it in person again. Next, James Stowe. James is the Director of Aging and Adult Services for the Mid-America Regional Council and Board President of the Missouri Association of Area Agencies on Aging for 9 more days. Is that how? Yeah,
That's right.
Yeah,
Yeah, not too much
Director
longer.
of Missouri for 9 more days. So
That's right.
how long has your term been, James?
I've served for 2 years as the board president. We like to switch things frequently and keep it fresh. So my colleague and Southeast Missouri, Lana Johnson, the Director of Aging Matters, will be taking the helm starting in July.
Okay, well, congratulations and thank you. I shall turn it over to you now.
Kathy, thank you. And thank you to all of the presenters today for the update. I thought this was a remarkable set of leaders, a remarkable amount of information. And we wanted you all to have a couple of key takeaways, call to action for following today's session. Of course, take part in the groups that were presented to you today. Participate in the coalitions and advocacy groups that are available to you to heighten the voice of older people and individuals with disabilities and those aging with disabilities. There are remarkable resources in both states. So don't hesitate to get involved. They can help you understand the parameters for advocacy that don't fall into lobbying for your organization. And as we've heard many times today, it is effective when we come together and have a common voice. Invite legislators to your meetings. This is a very simple step. You can invite them to listen to them. You can invite them to have a conversation on a specific topic. And we know that across both states, many organizations already have intimate, very healthy relationships with their legislators. But remember, if that's not happening in your organization, to take advantage of that opportunity, bring them to the table and help them to understand more directly what you're facing and what your constituents are facing as you provide services and really help people to thrive in the community. We also heard from many of the sponsors of today's event that specific action is needed on the tax rebate in Missouri. That's currently on Governor Parsons' desk for consideration. He does have the authority and ability to veto that measure. And really, this is about providing education on what that tax rebate needs to go to. And that includes individuals with disabilities and older adults who do pay taxes in many forms, and during this time of continued financial strain also need relief. And so the education needs to be there that any tax rebate should apply fairly to all groups and not just certain groups of individuals. We've also provided Missouri Voter Protection Coalition information to connect you to this group. We know that individuals with disabilities and older adults of all types have access restrictions in our society, including voting. And this group is really pioneering some ways to have those folks come to the table and be able to exercise their fundamental right to vote. So if you'd like to be involved in some of those efforts, there is a connection there. We can move to the next screen, please. And I would like to invite my colleagues, Kathy, back to the table, and Craig Eichelman with Missouri AARP for a period of question and discussion. And Kathy, I know you had some acknowledgements you wanted to make.
Yeah, thanks, James. Thanks for going through how people can be involved and be active. Craig's going to help with facilitating the Q&A, but before we turn to Craig as a surprise guest, I would like to introduce Glenda to the group. Glenda, are you still with us on camera? I just want to take this chance because I think this is the first time we've done this since you took over as the director of Aarp Kansas. So will you please just quickly introduce yourself? I want to make sure people know you.
Well, thank you so much, Kathy. Good morning, everyone. I am Glenda DuBoise, and I am the state director for Aarp Kansas, and happy to work along with Ernie and our staff, and really glad to meet with you and to get to know more about you, and we're really excited about how Missouri and Kansas are collaborating and working together. Thank you.
Thanks, Glenda. Welcome to the large two-state group. So
yes, it's great. Thank you.
Yes, Craig Eichelman is the state director for Aarp Missouri. Hi, Craig. I'm going to turn it over to you for you to help facilitate through questions and discussion.
Yeah, we were able to answer a few of the questions in real time, but there's one that I think maybe Jay or Lindsay could answer. It's about the increase in HCBS funding in Missouri, and if those increases will flow to wages and employee retention programs.
I'm not sure if anyone on our presenting panel has a more direct answer, but I do know that it's intended that some of that HCBS rate increase will flow to help the workforce crisis that's really across all care vocations in the country. However, I'm not sure if there are any specific regulations or other rules or requirements in that funding that would require an HCBS provider to directly fund additional wages. And we're also seeing that with the wage pressures, those increases may mean a little bit less for attracting and retaining new workforce in the current environment, but others may have additional information.
Jay says he's having trouble unmuting. So, Debbie has a question about where can I find more information about the Missouri HCBS funding increase?
So I can take a stab at this. Jay has definitely been following this more closely than I have. So he is going to be your probably primary contact. I would contact Jay and he's having trouble unmuting, so can't answer right now, but he has all those details. What I would add is, I can certainly find and forward the plan for that. But the other thing I would add to this, and I think the second part of the question is, what can you do to advocate? I would say, this is really an example of something that's both a state and federal advocacy task, because, I think the biggest thing that we really want to see is there's been a lot of talk about significant enhanced funding for what's kind of referred to as the care economy. So both childcare and home and community-based services, and there is real potential for that. So we need a significant amount of federal funding to be flowing down to the state level in order to support and retain the kinds of increases that this enabled Missouri and Kansas to do in the current year. So we really need a sustained advocacy at both the federal and state level here.
Okay. Jay, do you have anything to add, or are you still unable to?
No, I was able to unmute. So thank you so much for helping me out there. Yes, I would say that the idea was that the funding for the home and community-based services would go to wage increases, specifically getting people up to at least $15 an hour. And that there is some funding set aside for training programs specifically, though those have not been awarded yet to the recipients. We expect that to happen over the course of the next year. And there's no requirement specifically that that increased funding goes to wages necessarily. So it will really be up to each individual provider of home services to decide whether or not to increase those wages.
So how does that impact waiting lists, do you think?
Well, so we have an interesting situation in Missouri where legally we have no waiting list, but we have a shortage of providers, which leads to a waiting period. Basically, it's really in specific rural areas where that waiting list is the worst. So I will say that it should help, but we're unclear at this point whether or not that will bring more people into the system.
We got Debbie asking Jay, could you put the citation to the law regs into chat?
On home and community-based services, or basically it's just not included in the budget, that there is no requirement that it go to wages.
Okay.
And for those wanting to reach out to the governor about the tax rebate veto, do we have the bill number for folks to reference if they communicate? We might
Lindsay,
have to.
do you have that bill number off the top of your head?
Not off the top of my head, but I'm going to look this up real quick and I'll drop something in the chat to help.
And if Lindsay is delayed for any reason, we can include that in our follow-up email to attendees today. There it is.
All right. Kathy, I'm not seeing any other questions in the chat.
Does anybody have anything else? If you don't want to chat, we can attempt to follow a raise hand function if you'd rather ask them live and in person. So let me see. I don't see any. Really could ask us. For the group of presenters, lots of lovely feedback in the chat. People have enjoyed hearing this information. So it's a good group of people. Sheila wants to know when the recording will be made available. Kathy, I'll have you chat the answer to that because I don't know from Mark. Jay, I think you were going to take us out by talking about who all's behind this lovely event. And so let me turn it over to you. Wrap things up for us.
I think I might actually handle that, or if Jay would like
I
to.
say Jay, I'm sorry, James.
That's okay, no worries. I would not want to take Jay's light off of him. He's a great
No.
but we this year we have a remarkable set of sponsors that's really expanded, and you can tell that from this slide. Those who are coming together to exercise a voice of unity for what older people and individuals with disabilities really need in our state, how to focus our resources on what the most prevalent needs are, and really advance the lives of those that we care for and work with and for. So this is an amazing set of diverse entities. We encourage your entity to become involved at any point with these groups, and we hope to have future events available to you in the coming years. Let's go ahead and move to the final slide. We will follow up with an event survey to let us know how this could be improved for the future. That's always very valuable. So we encourage you to take just a few moments and fill out that survey when that arrives in your inbox. And then we expect to send out the email to the link to the recording of today's event within just 2 weeks of today. So that should be also populating your inbox. And I know that Kathy Boyer-Schessel with the MARC team here in Kansas City noted that we will be able to also provide the slides in case you were wondering about that. Just to conclude, we have House Bill 2090, which is the tax rebate bill number, in case you'd like to follow up with the governor's office on that. So again, I just want to warmly thank all of our presenters today, all of the information, and thank all of our attendees for taking the time. We just really look forward to a period of strong advocacy for some of the most vulnerable in our community and those who really need assistance to elevate their voice. Other than that, we just encourage you to have a great day, and thank you so much.